A 40-year-old gentleman was in a deep distress. His wife was massaging his left shoulder in order to reduce his pain. In last 48 hours, he had met three different doctors, super specialists to be precise, and have undergone various tests like ECG, echo, MRI of the shoulder and neck bone, and a lot of blood tests. Being an IT professional, he had been suffering from neck pain quite often. 3 days ago, the pain started to gradually shift to his left shoulder and arm. The patient googled his symptoms, which indicated the possibility of an imminent heart attack. The couple had rushed to a local doctor who performed normal blood test and sent him to a cardiologist. The cardiologist thought it could still be a myocardial infarction and perform a 2D echo test. It turned out to be normal, but to be on safer side, he prescribed a low dose of blood thinners, cholesterol medications, and advised him to get an opinion from an orthopedic surgeon. The pain was excruciating, and the orthopedic surgeon, being a specialist in the keyhole surgeries, suggested that it could be a tear in the shoulder tendons. He performed an MRI of the shoulder, which was equivocal. He gave the patient some more medications and suggested that he meet a neurologist just in case, just in case it could be a nervous problem. After examination, the neurologist too thought it could be a diabetes or a viral neuropathy based on the high blood sugar level, and he advised few tests and an MRI of cervical spine. Finally, it turned out to be a slipped disc in the neck bone. What we see here is a common healthcare problem. Every super specialist sees the patient and the patient symptoms only from that specialized narrow perspective. The clinical notes, investigation, and disease management all are tailored to suit the doctor's specialization. This is what is called as the Rashomon effect. Rashomon was a famous movie directed by a celebrated Japanese art movie director Akira Kurosawa. In this movie, a murder scene is described by different witnesses from their own point of view. All their views are very different from one another, but they all believed that they were speaking the truth because it appeared true from their own individual perspective. Similarly, every medical super specialist has his or her own approach towards the patient, typically focused on the system in which he or she has been specialized. Upper stomach pain is seen as esophagitis by the gastroenterologist, angina by the cardiologist, and costochondritis by the orthopedic surgeon. If we look at their clinical notes and examination findings, it would match their diagnosis since their mind is wearing the blinkers. The specialized mind fills the gaps based on his or her previous observations, specialized knowledge, and the myopic training. With increasing super specialization, the patient is not seen as a whole, but only as an affected organ. The specialist fall prey to the Rashomon effect and explain the patient's symptoms from the perspective of his or her own super specialization. It is difficult to avoid this in future. since the practitioners of general medicine are on the verge of getting extinct. Thanks to current trends in medical education in India, where there is a craze for super specialists. Some people might claim that it's a team work or team effect, that they are adding value to the diagnosis and management of the patient. But what if that team is putting burden on the patient for managing his or her condition? Then maybe that team work is not putting any value addition to the patient management. It should be done in the favor of the patient and not in their own practice. So let me know your thoughts in the comment section. What do you think about this Rashomon effect in healthcare, particularly in medical practice in India? And I welcome your thoughts in the comment section. If you like this video, please share this with your fellow doctor friends. And if you found this valuable, please give a thumbs up and do subscribe to this channel. This is Dr. Nitin signing out. Bye bye.